I'm Muriel Bowser. I'm the Mayor of Washington, D.C. I'm joined today by the Director of D.C. Health, LaQuandra Nesbitt, and the City Administrator for the District of Columbia, Kevin Donahue. Today, we are providing a situational update on the district's response to COVID-19. Specifically, I wanted Dr. Nesbitt to be able to speak publicly about what DC Health knows and what she knows in all of her discussions with national experts about the OMICRON variant. So with that, I'm going to turn directly to Dr. Nesbitt, and we will have an opportunity for questions.
Thank you, Madam Mayor. Thank you, Madam Mayor. So good afternoon, everyone. As many of you know, the B11529 COVID-19 variant, also known as Omicron, has been detected in the United States. Both the World Health Organization and the U.S. government, SARS-CoV-2 interagency group, have designated this variant strain a variant of concern, and coordinated efforts are underway worldwide to better understand this new variant. Similar to work that goes underway with other variants of concern being detected, there is still much more for us to learn. When we say that, what we mean is that, and you may recall with the experience we had with the Delta variant, is we want to understand things like where has the variant spread around the world. We now understand that several countries have been affected. We want to understand if the variant is more transmissible than other variants. Preliminary information suggests that this variant spreads very quickly. In South Africa, where the variant was initially detected, similar to other countries, it took several months for the Delta variant to become almost like the exclusive variant in those countries. For Omicron, it took just a few weeks. So we are learning still more about how transmissible this variant is. There's still more that we need to know about whether or not this variant causes a more severe form of illness. So what that means is if people are infected with the variant Omicron, are they more likely to have a more severe form of illness that could increase their likelihood of being hospitalized, cause them to have an experience in an ICU, or result in more people dying from COVID-19. We need to be able to understand if our vaccines that we currently have approved in the United States and worldwide will remain effective against the Omicron variant. We know that we have done a remarkable job here in the District of Columbia getting many of our residents vaccinated. Our residents who are 5 and older are all eligible for vaccination, and we want to have a high degree of confidence that those vaccines, including booster doses, still help to protect us from COVID-19 infection, severe illness, and hospitalization. We want to make sure that if you are infected with COVID-19, that the therapeutics such as monoclonal antibodies and antiviral medications will still be able to help treat your COVID-19 infection. So that's another thing that we have to be able to understand when a new variant is introduced. And the last thing that we have to be able to understand is whether or not those diagnostic tests, so when we talk about a PCR test or a rapid antigen over-the-counter test, if they are still able to detect the presence of COVID-19 in individuals. So as we endeavor in the public health and scientific community over the next couple of weeks to learn more, we will continue to keep our public up to date. But over the next few slides, we'll share with you all of the things we can continue to do as a community to protect ourselves and decrease our collective and individual risk of the spread of COVID-19 here in Washington, D.C. in the National Capital Region. So in the District of Columbia, DC Health mandates that all district hospitals and private laboratories sequence a minimum of 10% of their positive SARS-CoV-2 positive specimens and report that information to DC Health. Any laboratory that does not have the capacity or capability rather to perform sequencing can send 10% of their specimens to the DC Public Health Laboratory for sequencing. This requirement has been in place for quite some time. We are meeting that 10% minimum threshold routinely, and the district is among the top 10 states sharing the highest percentage of specimens and sequencing data with GISAID, which is which is a core system that helps to track the evolution of coronavirus and emerging variants. So we're doing a remarkable and exceptional job here in the District of Columbia with sequencing variants and detecting variants. You will see here just data from the month of November in terms of positive specimens that were sequenced, both at the Public Health Lab and other DC laboratories where information was submitted to DC Health and PHL. And about 97% of all positive specimens that were sequenced were positive for Delta as the variant. So Delta is the dominant variant in our community at this time, and we do have the ability to detect other variants, some named, and then there's this whole other thing called phylogenetics that myself and definitely the leadership at the Public Health Laboratory could explain in excruciating detail. So where are we now? The latest DC health metrics are presented here. The last time we were before you, we gave you all some metrics that we were transitioning to that would help individuals, businesses understand their individual and collective risks for COVID-19 in the District of Columbia. This slide you can see here, in the last month, we have seen a rise in COVID-related hospitalizations when compared to the previous month. But we've also seen an increase in the proportion of our residents who are fully vaccinated, and we want to continue to make that progress. Notably, that given the amount of community transmission that we have, mask indoors continues to be recommended. The key to ending this pandemic continues to be, and stopping the further spread of variants, continues to be layered mitigation strategies. We continue to recommend vaccination. If you have not been vaccinated, we recommend that you do so. We recommend that you get your boosters if indicated. We continue to recommend testing as a key part of our strategy. Individuals who have any symptoms at all should get tested. Don't leave it to yourself to decide that you're having a cold versus COVID-19 or these are just allergies. Go ahead and get a COVID-19 test. We also, again, recommend masking indoors. We want people to continue to choose their activities wisely based on your own health, the health of people in your household. You should be prudent with being in large gatherings, choosing to do our activities outdoors as much as possible. And as always, washing your hands frequently. It continues to be a key strategy to preventing the spread of any infectious disease. And of course, we want people to stay home if you are sick. It has been one of the best strategies we have for preventing the spread of any infection. Vaccination against COVID-19 is the best protection that we have. All district residents age 5 and older should get vaccinated as soon as possible. We want our residents to do this as well as get their flu shot. It's going to be critically important to continue to protect ourselves and ensure the stability of our health system this winter by getting your flu shots and all your other routine vaccinations, and making sure that you're taking care of your overall and total health, including your behavioral and mental health. It is a critically important time for us to remember to take care of ourselves overall. Now, for boosters, we want to be clear that boosters are a clear and effective strategy. We continue to get more and more information every day about the added benefit that boosters provide for protecting us from COVID-19 infection, severe illness, and hospitalization. We know that people over the age of 18 should get a booster. That's what we want to make clear. If you're over the age of 18, you should get a booster. So in very practical terms, any adult over the age of 18 who received the Johnson & Johnson vaccine before October 1st should get a booster. Any adult over the age of 18 who got the Moderna or Pfizer vaccine before June 1 should, in fact, get a booster. So how do you get vaccinated in the District of Columbia? Well, there's a couple of things we want you to know. Beginning Monday, December 6th, the whole family can get vaccinated at the same site, at our District of Columbia sponsored and partnership sites. So that means that our pediatric vaccine sites for ages 5 to 11 be available at all, pediatric vaccines, will be available at all library walk-up sites that had traditionally served those persons over the age of 12. And adults accompanying children to pediatric vaccination clinics will now be able to get their own vaccines at those pediatric-focused clinics beginning Monday, December 6th. This includes getting your, what we call the primary series, so your first or second dose, as well as being able to get your booster dose if you have not done so. So we want to make sure that people understand that very clearly. We want to make sure that there are adequate opportunities for people to get vaccinated in the district. So we will be adding 3 additional vaccination sites and making some changes to an existing site. The Benning Library's location will be replaced by the Capitol View Library location, and we will be adding 3 more sites to serve people 5 and older. The Martin Luther King Jr. Memorial Library, located at 901 G Street Northwest, Petworth Library, located at 4200 Kansas Avenue Northwest, and Woodridge Library, located at 1801 Hamlin Street Northeast, will all become new operational sites next week. We've maintained a service for our at-home vaccination program. We know that not everyone has the ability to come out to a site to be vaccinated. This site is open for people who need to be vaccinated at home. There are no specific requirements. You do not have to provide anything such as proof of limited or mobility or any homebound requirements. This is just simply open to people who have a need to be vaccinated at home. It could be due to convenience, the need to still be at home as a caregiver. Any of those things make you eligible for this program. On Monday, December 6th, we are proud to say that we will be able to expand the at-home vaccination program to children ages 5 to 11. So this can become a remarkable opportunity for the entire family to get vaccinated at home. And you can call 1-855-363-0333 to make an at-home vaccination appointment. So just to make very clear, what are the 4 ways to get vaccinated and boosted? Because we want people to know there's an ample supply of vaccine in the District of Columbia. Again, I'll repeat, there is an ample supply of vaccine in the District of Columbia, and there are 4 ways that we want people to think about when they make the decision to get vaccinated or to get their booster. First, you can walk up to a district-operated site, and those sites are updated and listed on VACCINATE.dc.gov. You can also make an at-home vaccination appointment, as I just described, by giving us a call at 855-363-0333. As always, you can make an appointment with your healthcare provider. There are several healthcare providers and provider organizations throughout the District of Columbia who are offering all 3 types of vaccines. And fourth, you can make an appointment at several of the pharmacy retail locations throughout the district at any site listed on vaccines.gov. So plenty of options. Some are walk-up and accessible 7 days a week, and some may require you to make an appointment. We still have testing, as I mentioned, as a critical part of our strategy to reduce the risk of infection for COVID-19. On average, we have about 40,000 or so tests that are conducted each week, similar to trends that we see around any major holiday. Going into the holiday, we see increased testing, and during the days of the holiday, we may see a decrease in testing. We expect that this week, we will be on track to have another week where we see our testing numbers well over 40,000. So how do you get a test? If you need a test, get a test for COVID-19. You can make an appointment with your healthcare provider to have a COVID-19 test. You can now do an over-the-counter at-home test. These tests are available at many retail locations throughout the District of Columbia, and you can log your results. It's important for us to know if you have a positive test result so we can help you make decisions. You should always isolate immediately, stay at home immediately if you have a positive COVID test. If you do or don't have symptoms, it's still important to stay at home if you have a positive COVID test. And then give us your results at coronavirus.dc.gov/over-the-counter. You can pick up and drop off a free at-home testing kit at any of the 27 sites we have at coronavirus.dc.gov/test yourself. And fourth, you can go to a district-operated walk-up site listed on coronavirus.dc.gov/testing. Now, masking. It's really important for us to note that DC Health will continue to advise and make recommendations on the use of masks for vaccinated and unvaccinated individuals. As I mentioned before at the start of our discussion, that our daily and weekly case rates indicate, according to the CDC recommendations, that all people wear masks indoors in public if they are in areas of substantial or high transmission. And currently, we are classified in substantial transmission in the District of Columbia. As such, DC Health has issued a mask advisory today that all people, regardless of vaccination status, should wear a mask indoors in public settings. So we want people to definitely heed that message. This is consistent with our previous statements to folks around how to follow our metrics and how to follow our guidance. And we want people to continue to be reminded that masks continue to be required in the following settings. Any private business that wants to have a mask requirement is able to do so. Healthcare facilities, including hospitals, primary care facilities, ambulatory surgical centers, urgent care facilities, you are required to wear a mask. Public transportation, like buses and trains inside train stations, airports, and while in rideshare vehicles, schools, childcare facilities, and libraries, congregate facilities such as nursing homes, assisted living facilities, shelters, and correctional facilities, and DC government facilities where there's direct interaction between employees and the public. As for the district's continued response, I'll turn it back over to the mayor.
Thank you, Dr. Nesbitt. And let me just add that part of what you heard from President Biden earlier and Dr. Nesbitt now is that the medical and scientific community is following its protocols when it comes to variants of concern. And the federal government and the district government are making sure that we can continue to respond if we see an increase in cases. And part of that is ensuring that our testing capacity is where we need it to be. So earlier in the fall, the authority that I have used throughout this pandemic to make sure that we have testing supplies, and that includes people, and it also includes the ability to advertise these different programs. And that emergency procurement authority was removed in November. So I'm asking the council to restore that authority so that we don't lose any time in procuring those supplies. So with that, we'll answer your questions. Yes, sorry.
Dr. Nesbitt, can you put a little meat on the bones on the hospitalization numbers worsening? What is your concern with that metric being in the worsening category, and what does that mean for the public here in DC?
Yeah, so it doesn't, it's not worsening in a way that is substantial or significant, Mark. I think one of the things that is important for folks to note is that if it goes from we had 52 hospitalizations one day and 53 the next, it's going to be listed as worsening, right? So it's not that we've had a huge percentage change from 1 week to the next or 1 day to the next. So it's nothing that I'm worried about. Sam?
One of the things that was kind of interesting was the Delta variant. So basically everything is Delta right now in DC?
Essentially, yes.
And
It has been for some time.
Okay, so it's really taken over.
Yes, sir, as it has in the rest of the country. That's been the status quo for the U.S.
What is the mask advisory now, and why not go back to a mask mandate?
The mask advisory is consistent with where the CDC is and where the country is. And it looks at the rate of transmission and makes recommendations for masking indoors, and that's exactly where we are. Yes.
Just to follow up on that, the city's case rate was about the same when you got rid of the indoor mask mandate as it is right now, and the CDC recommendations were exactly the same. Is what changed the Omicron variant? Is that why we're now having this advisory recommending masks rather than saying judge your own risk?
The Omicron has the appearance of and I'm always wanting to make sure I'm saying it right. Omicron is different than the last time we talked about masks, but the DC Health's recommendations around masking is really the same. But they're going to issue an advisory to make very clear that their guidance is related to the rate of transmission.
But that's not what the guidance was a few weeks ago. Right before Thanksgiving, the guidance was judge your own risk. It was not all people should wear a mask, right?
Julie, I would disagree. That you may have walked away with that as your interpretation, but our communication was very clear that while we're in high and substantial, that people should wear a mask. I think it's important to put a very fine point on the mayor's clarification to you that we want to be clear with people that my recommendation, DC Health's recommendation, is that people should wear a mask indoors regardless of their vaccination status, given the level of transmission we have. You have properly assessed that the level of transmission is the same as it were 2 weeks ago, and our recommendation is the same as it was 2 weeks ago from DC Health. But we want people to be abundantly clear about what we intend them to do.
But isn't what's new, I mean, you're releasing a new advisory, right? I mean, that's new. That's not the same as what was from.
It is new. It is new to make clear because clearly we were in a different posture with a mandate that affected all indoor places. So now our mandate affects our schools and hospitals and district buildings, in all private facilities that want to continue to have a mandate. And we did not want the message to be that there was no recommendation to wear masks indoors, because that's always been the case in cases where there's substantial or high transmission. The mask advisory, I think, packages that up very nicely for you and for members of the public to be clear what DC Health has advised. Yes.
Mayor Bowser, can you update us on, the last time we spoke at a COVID update, you said that you thought the next logical step would be for you to remove the testing option for DC government employees and just make it mandatory across the board for all of them to be vaccinated without that testing option. Are you any closer to that?
I don't think we are, Mark, like today, but we continue to look at the mandated employees in DC government and the mandated employees in the healthcare system. Those mandated employees include everyone working with our children in our schools and child care facilities, and our healthcare providers, including our fire and EMS. So those people are mandated. We haven't rolled it back. We haven't given them a testing option. The only, if there are any people who we don't know about at this point, is because they haven't submitted, in which case they would be in a disciplinary process, or their exemption requests are being reviewed.
And following that line there, could maybe the Deputy Mayor update us on that disciplinary process? But again, last we spoke, there were a handful.
Yep, sure. Kevin, do you have that?
You update us on
Okay.
both discipline and the waiver process, if any waivers have been denied or granted?
Sure. So across all of DC government, there's 880 individuals who are in some form of the disciplinary process related to the mandate. Most of those pertain to the educational mandate, and the first step is formal notification that someone's out of compliance. We do find when we do that, a number of people, it's often a large number, do go in, either get in compliance or, and I've said this before in these settings, that there's some people who've been vaccinated for months that have not wanted to inform us of their status. Now they have to, and they're going and doing that. The fire EMS numbers that I gave last time have not changed. So there are, I believe, 6 or 7 individuals who are in disciplinary status from fire EMS. So of the 880, the majority of those are in the educational. The educational mandate applies to that. Within that number, though, there's 204 full-time teachers. So most of that is not full-time teachers. Actually, most of that are substitutes that are often not active or intermittently going into schools. So the full-time teacher number is 204 teachers. Now, you asked about exemption statuses. There's 839 religious exemption requests across all of DC government. About 402 of those are religious exemption requests that pertain to the educational workers, and 306 pertain to the health workers. Across all of DC government, 22 religious exemption requests have been denied. One has been accepted, in other words, an exemption has been granted. 78 were people that were applying that still could test out. So the exemption didn't really have any effect. So they were actually denied because there was not a need to get a religious exemption. Medical exemptions, across all of DC government, there are 70 requests for medical exemptions. 11 have been denied, 8 have been accepted, the rest are pending.
Sam?
I understand that one of the reasons you held this news conference at 4 o'clock instead of 11 o'clock, the normal time, was that you wanted to wait to hear what the president had to say.
Yes.
Did he say anything that has changed your message to us?
I don't think so, Sam. And I didn't. We had an inkling of what he would talk about, but the main reason I wanted to gather today was so that Dr. Nesbitt could talk directly to DC residents about what her discussions at a national level mean for us. Yes, I'll take one. Yes.
Yeah, so just one follow-up for you and then one more for the mayor. Of the 204 teachers that are in some form of discipline, have any been removed from the classroom?
No, that's a good question. So let me clarify. So you raise a good point. So the discipline, except for, for everyone associated with the educational mandate, the form of discipline they're currently in is that formal written notification that they're out of compliance, which is in our collective bargaining agreements, the first formal step of formal discipline. The step after that would be some level of suspension, typically a 5-day suspension that would then lead to a longer-term leave without pay status. What other jurisdictions have found is when they make that leap from a written notification to you losing pay for, say, 5 days, that numbers do go down. So all those 204 teachers are at their written notification status. No one at this point has been suspended.
And then Mayor Bowser, on the Emergency Procurement Authority, can you help us understand if something that you wanted to do, you wanted to purchase, something important wasn't purchased because of this, or how can we kind of relate to that?
Yes.
It's kind of like government speak to us.
It is a little bit, but let me just say, the reason that we have been able to deploy so quickly throughout this response is because we have been using a process. We agreed with the council with how to do purchasing that is in an emergency posture. And that just makes us be able to compete in the market for goods a lot faster and procure those goods. So I was made aware yesterday that DC Health was not able to get as fast as we need these at-home testing kits. And I'm talking about the rapid test. And as you know, supply chains the way they are, we need to be in the market and we don't need to be delayed. Similarly, the testing kits that we have been using where people are picking up from their libraries, we need to be able to procure large amounts of those. So as the president emphasized earlier, to your point, Sam, their recommendations to us is to be, and to the American people and to district residents, is that avail yourself of testing. So if you are exposed, you can isolate, and we don't have the type of spread that will take off and really cripple our country. So testing and amping up those supplies is very important. And there could be other things that we right now aren't anticipating, or we are anticipating, but we need to do them faster. So it's a point that we just want to convey with some urgency. Yes.
For folks who are watching at home who maybe are paying close attention to the mask advisory, who aren't always paying attention to public health, can you give people some context about what is a public health advisory? What are the situations where we use that tool?
Yeah, great question. I advise you to take a specific action because the conditions in our community suggest that you should in order for you to be safe.
Can you give some examples of other times you would
This.
use a public health advisory?
This.
Any
Do
other
this.
times you've used this?
I've been here 7 years, so I'd have to think about that.
I mean, could you do like a vaccine advisory then, or like, are there other advisories?
We could. We've been advising in a lot of ways about vaccines.
Or well, so whether or not I've done one, but I think you're familiar with like boil water advisories, and we have meetings with DC Water for those, right? So I'm not sure what other context to kind of give you, right? So think along those lines.
Yeah, just a couple more. Yep.
I'd like to ask about, I mean, you mentioned self-test kits. How hard is it to find things on the market now? And could you give some sort of insights into that? I mean, when the pandemic first hit, obviously states and everyone competing with one another. Is the market getting difficult again? Is that, and what specifically are you seeking in addition to self-test kits, and how many?
Yeah, so it depends on the product, right? So I think there's a huge difference in terms of what exactly we're trying to procure in different time frames, right? So when something new comes to market, naturally any manufacturer or producer probably has a period of time where they need to ramp up production, understand what demand for their product would be, and eventually reach equilibrium for demand and supply. So we don't see in a lot of different products the types of need for ramp up or a lot of the supply chain challenges we saw in early 2020 when we were all figuring out exactly what the pandemic would be in terms of, difficulty even finding nasal swabs. Nothing at all to suggest that. But when vaccine production was first beginning and people couldn't even procure glass vials to package vaccine. So we're not seeing those types of supply chain issues, and those aren't the discussions. What we have disclosed to Mayor Bowser is that there are certain over-the-counter tests, and one of the things I'm most proud about for DC is that we have provided the COVID-19 testing for free for our residents. And that testing has largely been the PCR testing that initially we were turning around test results in 5 to 7 days. Now we're turning around test results in 1 to 2 days. We would like to be able to go a step even further and provide rapid testing where you get results in 15 minutes for free for our residents. So we need to be able to compete in the marketplace for procuring those types of tests for people. Right now, you have to purchase them over the counter, and we know for some of our residents, it's not affordable to go to a retail location and to have to pay $10, $15, $20 for a COVID test. I recognize that the president this morning or earlier today has called on insurance companies to have to reimburse for those, but reimbursement is a very different thing from no out-of-pocket costs initially.
An off-topic question. It looks like we might be headed for another government shutdown. I know when the federal government is shut down before, the district has had to step in to do things like pick up the trash on the National Mall. Can you talk about how this shutdown might affect the district and how you're preparing?
Well, when I came in here, I thought that they were saying otherwise, that there was a resolution. Is that not right?
I didn't see anything.
Oh.
Well, that is great if that's true.
Well, I don't know. I guess it's not over until it's over, but I don't know. I don't think that we're going to have a government shutdown. I guess that's what my gut tells me. And if we do, because of legislation that our Congresswoman had enacted some years ago, our government is not affected. And so if we need to pitch in the federal parts of the city, we certainly will. All right, thank you.